The HOPE trial was a trial of Voxelotor, or the trade name of Oxbryta, for improvement in anemia in sickle cell disease. And it was a positive trial as well from Global Blood Therapeutics. This is also a supportive and secondary outcome presentation from that trial. We were able to show using a measure called the Clinical Global Impression of Change, which is a physician rating from much worse to much better of how they think the patient is doing at an individual visit. These physicians were blinded, so they did not know whether patients were on Oxbryta or placebo. And they were asked at visits whether they thought their patients were improved, and they were asked mainly at the 24-week interval, and were found to say that in general, the patients who were on Oxbryta, the physicians rated them in general as more improved than the patients who were on placebo. This was analogous to the patient's global impression of change, which is a long used measure of improvement. You know, in sickle cell disease, improvement is a difficult thing to gauge. So this shorthand measure, the clinical global impression of change, does bring some hope to, pardon the pun, those who are doing trials in the future for drugs like Oxbryta, because it seems to improve pain, fatigue, and other underlying constructs, which a physician is judging implicitly at a visit. So this was, again, another hypothesis-raising trial, and also a sort of a validation of the clinical global impression of change as a potential marker for use in registration trials.